Sleep apnea is a very common sleep disorder. In fact, amongst all the sleep disorders, the most common sleep disorder is sleep apnea. What happens in sleep apnea is there is a disruption in the breathing which happens repeatedly. So, to say in simple terms, sleep apnea means interruption in breathing or pauses that happen in breathing during sleep. So, this is called sleep apnea. Now, what happens is when there is a pause in the breathing, there is low oxygen level that happens, and then later on, because the brain sends a signal, again the breathing starts. So, when this breathing stops and then the breathing starts, this sort of events happen many times, for sometimes even hundreds of times in the night. Now, when this breathing starts, the brain also wakes the patient up transiently. We might not realize, but the patient also sometimes wakes up. So, the breathing cessation leads to low oxygen levels. The disruption in sleep again plays havoc in the daytime routine. So, the two main events because of disruption of breathing in the sleep is that low oxygen levels and sleep disturbance, and these play a lot of havoc with the patient's health, which we can actually discuss later on. The sleep apnea, though we find it to be common, is most of the times goes undiagnosed. The patient is happily unaware of what is happening to him or her in the night time. In fact, most of the times the bed partner or the spouse might know how the patient is suffering. In fact, they also do suffer because of sleep deprivation. So, when we ask the patients, most of them might think that they are sleeping well. In fact, they are snoring and sleeping well, snoring being the most common symptom of sleep apnea. However, this is the most underdiagnosed disease because the family and the patients do not come and say, yes, we have sleep apnea. The doctor's awareness of late is increasing, but still most of the patients of sleep apnea go underdiagnosed. In fact, for every 10 patients that I see in my clinic, at least or about 1 to 2 patients definitely present with sleep apnea and associated complications. Now, with the increasing lifestyle changes and obesity becoming an epidemic and increasing lifespan, we are going to see more and more cases of sleep apnea, and unless there is increased awareness among the healthcare professionals and high index of suspicion, knowing sleep apnea is associated with a lot of complications, it is going to have an effect on the people's lives. Predominantly, there are two types of sleep apnea. One is called a central sleep apnea. The second is called an obstructive sleep apnea. Now, the most common again is an obstructive sleep apnea. What we mean by central sleep apnea is the center in our brain which controls the breathing sometimes sends a wrong signal or sometimes doesn't send a proper signal to our breathing muscles, so that the patient does not take breath in the sleep. Now, central sleep apnea contributes to about 10 to 20% of the cases. It is not very common, and in this the patient doesn't have snoring. The patient suddenly wakes up from the sleep either with a feeling of breathlessness, or patient finds it difficult to sleep and wakes up multiple times in the sleep. Whereas obstructive sleep apnea is the most common type of sleep apnea, and that is the one that has to be discussed a lot. In obstructive sleep apnea, snoring is present. Most of the times patient might be obese, and obstructive sleep apnea patients can present with lot of complications. Whereas central sleep apnea are typically associated with certain diseases of heart and certain diseases of the brain and with certain medications. So, basically, as we said, the obstructive sleep apnea is the most common type of sleep apnea. Now, when we look at the breathing tube, this is called the upper airway, and this is the entry point for the oxygen or the air from the atmosphere to go into the lungs, and then from there to be supplied to various parts of the body. Now, every part in our body needs oxygen, including the brain, be it the heart, be it the brain, kidneys, lung, everything requires oxygen. Now, if this is the upper airway, that is the route for entry of oxygen. Now, this upper airway is contributed, here we can see the tongue. Now, the tonsils are somewhere here. This is called uvula. This is a small projection that comes from the throat, the back of the throat, the palate, all these contribute the upper airway. Now, there are certain muscles which supply this upper airway. Now, because of various reasons, be it obesity or be it because of excess tissue, when the tone in the muscles is lost, when the muscles are not functioning effectively, the whole airway is not supported well, and when the patient lies down, takes a breath, these airways become narrow, and when air passes through a narrow passage because of the vibration of the tissues, that is when we hear the snoring. Now snoring might be present in many people, in fact 40% of the general population, up to 40% might snore, but people who snore severely are those who have severe obstruction. That means the airflow is getting stopped for some seconds significantly during night time, and when the airflow stops or significantly reduces, that is when it's called apnea or hypoapnea. Now at that time, because we cannot, now when we get breathless in the daytime, we are not getting enough oxygen, we try to take help. Now what happens in the sleep is the patient silently suffers or the sleep gets disturbed. That is when the brain makes the person awake, and then this opens up. That is when the patient sometimes in severe episodes can wake up either with a dry mouth or choking or sore throat or something like that, or a feeling of breathlessness. So this sort of repeated closing and opening happens throughout the night, causing disruption of sleep and low oxygen levels. So basically we have said that there is a repeated closure of the airway because of inefficiency of the muscles supporting the throat. So anybody can develop obstructive sleep apnea, including children, but there are certain factors which predispose a person. That means a person is more prone to sleep apnea because of various factors. First important factor being obesity. Yes, a person who is obese is more prone for obstructive sleep apnea as compared to a non-obese person, and particularly the neck size, the collar size of 17 in men and collar size of 15 in women is associated with obstructive sleep apnea because that narrows the throat during sleep. Another important factor is we Asians are more prone for a narrow airway or the narrow throat. We are sometimes naturally, when we are born itself, the way our bones and tissues are formed, our airway itself becomes narrow. So by birth some people have a narrow airway. That is why we see that snoring and sleep apnea runs in families. Many people in the family snore and many people tend to have sleep apnea in the same family. So when they come and try to give the history, they say yes, even my mother does snore or my father snores. So the way the airway is structured can be congenital. Then there could be some extra bone or extra tissues either in the nasal passage or in the throat or back of the throat, which might require a surgical correction, and that also can lead to sleep apnea. Uncontrolled nasal allergies also can aggravate the sleep apnea. Then men per se are 2 times more prone to sleep apnea than women. Old age, as the person ages, the chances of sleep apnea increases. Then certain factors like alcohol, particularly smoking. Smoking actually irritates the airways a lot and causes inflammation and water retention and predisposes to sleep apnea. And particularly in children, these nasal bone and throat abnormalities can lead to sleep apnea, leading to reduced attention and learning problems in children. So in fact the symptoms of obstructive sleep apnea are very varied. Unless the doctor is aware of the various, unless the suspicion is high, it is very difficult to pinpoint, because you have to ask, the doctor has to ask for the snoring history, and in fact the patient might not be aware. When you ask the patient, they might say, no, I do not snore, but the spouse history becomes very important there. So predominantly they have nighttime snoring, nighttime sleep disruption. They tend to get up more frequently in the nighttime, either for going for urination or even otherwise. And they have what is called a witnessed apnea. That means the patient stops breathing completely in between for few seconds, and then again they might wake up, or they just resume their breathing with a choking sound. Then there could be a very loud snoring, which might be causing sleep deprivation to the partner also. Then when these are all the nighttime symptoms, and when they wake up in the morning, they do not have the freshness that they are supposed to have even after sleeping for 7 to 8 hours. The lack of freshness is a very, very important sign, and particularly the younger working people, they might have problems in their concentration skills, in their cognitive skills. They might have more forgetfulness and all these things, so which might lead to, many people do come with symptoms of not able to focus, missing promotions, reduced social life, irritability, concentration problems and all these things. So these are the usual day-to-day manifestations of sleep apnea. However, when a patient comes to us with sleep apnea, we do look for some signs to see whether this patient has any diseases associated. Now whenever we see a patient with sleep apnea who has got a high blood pressure, then there is a strong possibility that there is an association between both the two. So, is the uncontrolled sleep apnea causing a hypertension? That is the doubt that comes to our mind. And then, is the patient obese? Then we ask them to open their airway and see whether it's very crowded. We grade the airway based upon the crowding. So, if it's a very crowded airway and patient is obese, or patient has a thick neck, or has hypertension, patient has some swelling of the legs, then this shows that yes, this sleep apnea is associated with some complications in this patient. Then another important aspect is the complications of sleep apnea. So, when the patient repeatedly gets low oxygen levels in the night time and the patient's sleep is disturbed, naturally we know that it is going to take a toll on health. It is logical. But again, the research and science has proven that yes, untreated moderate to severe sleep apnea is associated with a lot of health problems. What are those health problems? Patients are more prone for hypertension. There is a very strong link, as I said, between hypertension and untreated obstructive sleep apnea. Diabetes, and again sugar control also becomes problem in diabetes with sleep apnea patients. Asthma gets aggravated in sleep apnea patients. Various types of heart diseases are associated with sleep apnea. Then there could be strokes which are associated with sleep apnea. Then most importantly, most of the times we talk about sleep apnea as an outpatient setting. Patient coming to the outpatient department, yes, he has sleep apnea, and then getting diagnosed and treated. But we do see patients who come in a emergency situation to the emergency room, getting admitted to the ICU because this patient has got a very severe sleep apnea. He or she is unable to wash out their carbon dioxide. They come with very low oxygen levels or sometimes comatose because of this problem, and requiring a ventilation or requiring a non-invasive ventilation in the ICU, requiring lot of intense treatment to save their lives. So, this sort of a situation also can happen. Another important point is these untreated sleep apnea patients are more prone for complications with certain medicines like sleeping pills, tranquilizers, narcotics and all those. And these sleep apnea patients are also bad candidates for surgery. So, when somebody is going for a general anesthesia and if they have sleep apnea, so they have to inform the anesthetist beforehand, otherwise they might land up into complications because the tone of the upper airway muscles further reduces and leads to complications post surgery. In fact, the diagnosis of sleep apnea is a little unusual, not the routine testing. There is no single blood test that can diagnose sleep apnea. In the same way, it is not a radiological investigation like X-ray, ultrasound or CT scan routinely that we do for other diseases that diagnoses sleep apnea. First important thing is to have a high index of suspicion by the specialist. So, and the symptoms are also very varied. The patient might come with snoring sometimes patient might run to various specialties because of fatigue or because of sleeplessness, inability to sleep. They might go to a psychiatrist or to a physician. They might go to a cardiologist with uncontrolled hypertension. We do see different types of patients getting admitted with a severe accident, maybe because of underlying sleep apnea. We do see patients repeatedly getting admitted with heart failures, uncontrolled hypertensions, having 2-3 admissions per year, and underlying problem could be sleep apnea. So, the presentation could be very varied, but all these patients we need to see whether there is underlying sleep apnea. So, anybody who snores, who has fragmented sleep, who has daytime sleepiness, who has lack of freshness with or without associated complications either like diabetes or hypertension, these patients need to be tested for sleep apnea. Now, the way we test for sleep apnea is doing a test called sleep study. In simple terms, in technical terms it is called polysomnography, and wherein there are different levels in doing a sleep study. Doing a proper detailed initial sleep evaluation and sleep study is very important for proper diagnosis. Now, what we do in sleep study is, this is a painless procedure, and the patient will be sleeping in the lab instead of sleeping at home, and a lot of sensors will be attached to the patient to detect to monitor the heart activity, lung activity and brain activity. How is the patient breathing, how severe is the snoring, is the oxygen level dropping during this episode, and is the patient going into a deep sleep or not. All these variables, the leg movements, the respiratory movements, chest movements, all those will be monitored and recorded into a computer. It will be attended by a technician throughout the night, and a lot of technology is involved, and nowadays lot of sleep studies are being done everywhere, but having a proper detailed sleep study under the supervision of a sleep specialist, pulmonary and sleep specialist, is very important, because the benefit to the patient management depends upon the quality of the study. Now, also there is a lot of inertia or what do you call inhibition in getting a sleep study done, but once properly screened, the high risk population who are prone for sleep apnea should get their sleep study done at the earliest, because we know whether after sleep study whether it is only a snoring or sleep apnea. If it is a sleep apnea, is it mild, moderate or severe? It is very, very important to know, because untreated moderate to severe sleep apnea we know is associated with diseases and also reduced lifespan. Now, the most common question that the patients ask when they come to us is, are there no medicines for it? Because they come with that impression that yes, I have snoring. Now, doctor is telling all my symptoms just by asking 1 or 2 questions. They feel very happy that yes, my diagnosis has been made. Yes, I am unable to sleep well, and all this they are very happy. But the moment we say that there are no medicines for it, that is when the problem starts. So, it becomes our responsibility to tell that this is a chronic disease. Like diabetes, like hypertension, this is a chronic disease. Unfortunately, there are no medicines available for this. It requires sometimes a multidisciplinary approach. That means we might have to take consultation from ENT specialist and other specialists if required. Sometimes we might have to refer to the cardiologist for certain adjustment of some heart medicines. So, multiple team effort is required and long term management is required for this disease. That is very important. Now, once we categorize the disease into mild, moderate or severe, and then for mild sleep apnea, lot of behavioral or lifestyle changes we advocate. We ask the patient to lose weight, go for regular exercise to cut down on the carbohydrate and fatty foods. We ask them sometimes to sleep to the side, called the tennis ball technique, wherein patient sleeps to the side, the airway tends to not to collapse that much. So, some positional therapy this is called. This type of therapy works for few patients of mild sleep apnea patients. So, these are the behavioral therapy. In that we also say that yes, try to avoid the alcohol before bedtime, avoid smoking completely and not to use any tranquilizers or sleeping pills. So, these are all the lifestyle changes that the patient has to make. Now, this is effective for mild cases. Now, any patient who has a moderate to severe sleep apnea, as per American Association of Sleep Medicine, CPAP is the treatment. What we mean by CPAP is, I will talk about it in detail little later. It is a machine which gives pressurized air. That means a pressure which is higher than the atmospheric pressure, and it keeps the airway open. So, the CPAP is the best modality of treatment for moderate to severe sleep apneas. Now, many people do ask, is there any surgery for sleep apnea? Whenever there is, as I said, a bone that is obstructing the airflow, or whenever there are tonsils are hypertrophied or adenoids, all these things are more, yes, definitely surgical correction is there. Then the CPAP tolerance also becomes easier. But there are certain extensive surgeries are also available for sleep apnea. The success rate varies. Even now, still the gold standard becomes the CPAP machine. There are certain dental appliances also available depending upon the severity. In mild cases, in people who do not tolerate the CPAP, these dental appliances can be tried. Yeah, as I said, for a moderate to severe sleep apnea, CPAP is the best modality of treatment. Now, what we mean by CPAP is, because the airway is getting closed here, the upper airway, now we give some pressure from outside, which is above the atmospheric pressure. This is just a increased pressure which acts as an air splint. It is provided through a blower, through a machine, and a mask, a nice fitting mask is put either through over the mouth, over the mouth and nose, or only over the nose, nasal mask or face mask, and this pressurized air is delivered inside. Now, when we do a diagnostic sleep study, that is when we decide how much is the pressure requirement as a part of sleep study to keep this airway open. This might range from patient to patient. So, the pressure ranges are usually between 4 to 20 centimeters or so, 20 to 25 centimeters. A particular patient might require 7 centimeters or 9 centimeters of pressure. So, once we decide the pressure requirement, then this CPAP machine has to be put to the patient daily in the night time. Then again, though CPAP gives excellent results depending upon the severity, the more severe the patient, the better the result is. Still, there is lot of inhibition and they think more of as it as a taboo to use a CPAP machine in the night time. Now, awareness is increasing and lot of patients are using CPAP machines. Some people try to use for a week or so and then say, no, we are unable to tolerate, and non-compliance occurs. Why non-compliance occurs? In that, half of it is that lack of awareness. So education to the patient before starting the machine, why is the machine important, is very very important, and they should understand how the machine works and why is it that they are requiring the machine. Choosing the correct pressure, choosing the correct machine, and fitting the correct mask to the patient is very important, and they should be slowly made to get adjusted to the mask rather than forcing it on the patient. With all these things and the latest technology and the type of masks that are available now, the CPAP compliance has increased a lot and patients are using CPAP more and more and leading normal lives. Another important, which I did not mention, an important complication of untreated moderate to severe obstructive sleep apnea is increased incidence of road traffic accidents. In fact, after alcohol, this is one of the most important factors which leads to motor vehicle accidents. Now, if a person who is driving a public vehicle, public transport vehicle like a train or a truck, bus or plane, now if he or she is suffering from obstructive sleep apnea, then there are no stringent laws in India to see what is going to happen. There are a lot of famous accidents that happened that have been attributed to either sleep deprivation or because of sleep apnea. Now in India it is very very difficult to see how many, if we will be surprised to know how many of the truckers or bus drivers are suffering from sleep apnea. Now for the airplane pilots, something has been put in place, at least by the aviation authorities. They do come for sleep studies when their weight is more, but nothing like that is happening for other modes of transport. It is very very important for our pulmonary and sleep specialists to increase awareness to the government also regarding this, and unless something is taken up, a cheaper diagnostic price should be put for this, maybe sponsored by the government, some amount to be contributed to the government, so that they can be diagnosed and treated at a more economical price to avert these public road traffic accidents. What happens exactly is that because of the disrupted sleep or poor quality sleep, whenever they are going particularly on a road with not much traffic, particularly in the night time, they try to catch up on what is called the micro sleep, even for few seconds if they take in, if they doze off, and the decision making gets affected when they wake up from their sleep. So this leads to accidents. As I said, the metabolic complications, untreated moderate to severe sleep apnea is strongly associated with hypertension, diabetes. Again, in diabetes, the blood sugar control also is poor when sleep apnea is associated, and it can lead to various forms of heart disease. It could be heart failure, it could be a heart attack, it could be a rhythm disturbance, and stroke patients also later on develop sleep apnea because of reduced tone. Motor vehicle accidents, metabolic syndrome. So all these patients of sleep apnea finally untreated land up in metabolic syndrome. That means they have hypertension, they have diabetes, they have high cholesterol and obesity. So these things sleep apnea patients are more prone for all these diseases, and also it has been shown that severe sleep apnea is associated with reduced lifespan. Diabetes, yes, our India is becoming the diabetic hub of the world, and every second patient we find to be diabetics, and diabetes also is associated with obesity. So there are also various other reasons why diabetic patients are more prone for sleep apnea, but about 50% of the diabetic patients are found to have sleep apnea. Now it works in a two-way relationship. Diabetics develop sleep apnea patients develop diabetes. Sleep apnea uncontrolled leads to a lot of catecholamine release and lot of hormonal dysregulation, leptin resistance and all this, and this leads to diabetes. And once sleep apnea patients develops diabetes, the blood sugar control also will not be effective because of insulin resistance. So sleep apnea and diabetes is a very bad combination, and all diabetic patients should be screened for sleep apnea. Then another important cause for death in our country is cardiovascular diseases. Sudden cardiac deaths occurring particularly in women is very very common, particularly once women reach menopause, that is once they cross 50 years, the risk for sleep apnea increases. It becomes equal as compared to men, and also the risk for heart disease increases. So particularly in women, cardiovascular risk along with sleep apnea can lead to lot of complications. Now, when I say cardiovascular disease, the most common disease is hypertension. About 40% of hypertensive patients have sleep apnea. Now, overall if you look at it, about 80% of the cardiovascular disease patients have sleep apnea. Now, these patients with untreated severe sleep apnea, they are more prone for heart attacks. It has been proven to have more heart attacks, more amount of cardiac failures, congestive heart failures. That means heart not working well and patient going into fluid accumulation in the lung, getting hospitalizations frequently and all that. Then another important point is the heart rate disturbances that occur, particularly in the night time when oxygen level is low. These are called arrhythmias. And these arrhythmias sometimes can cause sudden cardiac deaths also. This is also, in fact, one type of arrhythmia called atrial fibrillation. It is almost about 2.5 times more common in patients with sleep apnea as compared to normal people. So, all these associations are there in cardiovascular diseases. So, any patient with cardiovascular disease, we need to definitely rule out underlying sleep apnea. In fact, we do get such sort of patients who are they sometimes they are on 5 or 6 type of antihypertensives. We had a patient like that, and he had underlying sleep apnea, refused to use the CPAP, finally accepted, and then we could reduce the antihypertensives from 6 to 3. So, uncontrolled hypertension, we do get lot of referrals from the cardiologists wherein patient going for 2 types of antihypertensives. Definitely underlying sleep apnea has to be looked for, cause for uncontrolled hypertension, and then it has to be treated with CPAP.